There's a cutting-edge advancement in kidney transplant surgery happening at the Hume Lee Transplant Center with robotic technology. It's innovative, minimally invasive, and even helps patients recover faster. This procedure helps recipients and living donors alike. Let's talk about it with Dr. Chandra Bhatti, a transplant surgeon at the VCU Health Hume Lee Transplant Center. This is Healthy with VCU Health. I'm Prakash Chandran. So Dr. Bhatti, I actually understand that you were the first surgeon on the East Coast to complete this robotic-assisted kidney implant. So tell us a little bit about your experience and about this new procedure.
Typically, kidney transplant has always been associated with big surgery and giving a big scar to the patient. We are one of few centers in the country as well as in the world who perform the surgery using a minimal invasive surgery, means doing a surgery with the keyhole. We were the first one to complete robotic, means no hand assistant at all. During the transplantation, we were the first one to perform in East Coast without any need or any assistance of hand.
Okay, and so when you say minimally invasive, what does that mean?
Minimal invasive means making a very small hole inside the abdomen, about 3-4 small hole. Each hole is about 8 millimeter to a centimeter in a size, and performing the surgery through these keyhole incisions. That's the minimal invasive. Typically, invasive means the bigger surgery, having a large cut inside the abdomen and taking longer time to perform, while we do the surgery, which we call as a minimal invasive, where you make a small holes and put an instrument through those holes and do the surgery.
And what makes these incisions smaller than open surgery?
The robot is still run by us. Basically, we drive the robot. When we talk about the minimal invasive approach, what it does is basically make a smaller incision and connect that to a robot, and then we drive the robot. That helps a lot because when you do an open surgery and make a bigger cut, the tissue trauma means the trauma to your body is much higher, which takes everything longer to heal. While when we make a smaller incision and connect it to the robot, who does the surgery guided by us, has a much more smoother, much more better vision, and a less trauma to the body.
I'm really glad that you made that distinction because I'm sure a lot of people listening maybe think that a robot is just doing all the work, but I think from what you're telling me, it's just an extension of your hands. Is that correct?
Exactly. So the big benefit of a robot is it behaves exactly my hand would behave. So what happens is we put a small hole inside the body and connect it with the robot. And if I move my finger right side, that arm will move on the right side. If I move it on the left side, my arm move on the left side, the robot will move on the left side. So it's exactly whatever I'm doing with my hand, the arm does exactly the same way. So it's exactly what you said is absolutely correct. It's an extension of a human hand.
That's insane. I feel like we're living in the future here. So maybe talk to us a little bit about how traditional implants were done. You know, I know that there's a donor. I know that there's a recipient. I imagine that's all normally done by hand. But with this robotic-assisted surgery, how does it work?
So as I was talking before, that traditionally what we have happening is we used to make about 15 to 20 centimeter long incision and cut the muscles, go inside the abdomen. When we were taking out a kidney, we would spend 2-3 hours and dissect the kidney and take it out and close the patient again with the three big muscles cut through those abdomen and taking it out, which will give a large incision to the patient. Patient will stay in the hospital longer and have much more trauma to the body. While with the robotic techniques, as I said, we make a smaller incision, we go and do the surgery without making a huge cut. So no muscles are cut, no need to divide the 3 muscles. So imagine having tiny 3-4 holes for whole surgery. The kidney transplantation, which was till few years ago, was considered an open surgery, and it is an open surgery in most of a program around the world. As I said before, there are only limited centers I would count on my fingers who would do this with this latest technology and give a very small scar, almost practically a scarless operation where you have only 8 to 10 centimeter long incision just to drop a kidney in or take a kidney out. That's all the scar is given to the patient.
That's incredible. So tell us a little bit about how long the procedure normally takes and what the average recovery time is.
When we do the surgery with the robot, the recipient operation means the patient who's getting a kidney will take about 3 to 4 hours. And when we do the donor operation, take only between an hour and a half to 2 hours. When we talk about the recovery, you know, previous time when we were doing this surgery with the open approach, the patient was staying in the hospital for 5 to 6 days. Now, patient is out of the hospital within 36 hours of the operation. So they pretty much stay one day in a hospital other than the day of admission, and they are out of the hospital. And when we're talking about the recipient side, typically the patient would stay in a hospital for 4 to 5 days. Now with the robotic surgery, patient is typically staying in a hospital for 3 days. If they're staying longer, they're not staying because they need to, for the surgical purposes, they need to have a more immunosuppression medication. But from surgical point of view, most of the patients leave the hospital by day 3.
Okay, so it seems like everyone would want to get robotic assistance here, but is there an ideal candidate for this type of procedure?
We are still in an early setup for these transplantation, and we have been doing it for nearly a year or two. So we are offering it to the people who are relatively don't have much disease in their blood vessels, where the sewing with the robot is not that hard. At the same time, we are doing it in a people who don't have a significant heart history, so that we are making sure we are not putting too much oxygen, too much carbon dioxide in their abdomen while we are operating. So these are the 2-3 people who we are excluding, but otherwise we are pretty much including every patient who can have a surgery through an open approach. We should be able to offer the same surgery with the robot. There is no compromise in the outcome. Outcome are exactly as good as they would be with the open surgery. So there is no compromise on a long-term outcome, with the same result, with the much earlier, quicker recovery, and patient return to their work much quicker than they would return back through the open surgery.
I know you said there's no compromise in outcome, but what about any additional risks or complications that are involved with robotic assisted technology? Can you talk about that?
So typically we say that there are in terms of additional risk, the only risk involved is that conversion to open surgery. But other than that, there is no additional risk involved which would have in an open surgery and not have in a robotic surgery. The complications are pretty much comparable into both groups. Outcomes are same, complications are same, recovery is much better, trauma is much less, return to work is much sooner, and patient satisfaction is much higher with the minimal invasive approach or robotic approach than the open approach. The complication is no different from what they would have in an open surgery.
Yeah, it seems like it's a win all around. So I have to ask the question, in addition to kidney transplants, is robotic assisted surgery performed for other conditions at the Hume Lee Transplant Center?
So we do perform the robotic assisted surgery for liver cancer, where we take out a part of a liver, half a liver, and we are doing this with more and more surgery. So patients who have bile duct problems, where the basically liver produce bile and that goes from the liver to the bowel, and if there is anything happening during the way by which bile goes from liver to a bowel, we operate all through the robot, taking half of the liver, including a right lobe or left lobe, we perform with the robot. We're doing much more other surgery with the robot as well, where we are taking a gallbladder out in a patient who has a significant liver disease, including liver cirrhosis, where most of people would not operate on them. We do the surgery with the robot, and they are typically used to stay in a hospital for 4 or 5 days, and now they're going home on a same day or very next day.
It is really incredible to hear all this, and I imagine something that you see is that donors are more willing to donate an organ because of the recovery time and the advancements in technology, wouldn't you say?
Absolutely. No, we have definitely seen that the patients are much more happier to have the surgery with the robot. To give you just one example, I have had a patient, not one, like quite a few examples, where the patient returned back to work within 4 to 5 days after surgery. And I remember when I was in a training, when we were doing the surgery with the open approach, patient was taking 4 to 6 weeks off. And now going back to work within a week and taking pain medication only for 3 to 4 days is revolutionized for them. They feel much better. They are eating, drinking, they walk, and they go home much quicker or return back to work in much speedier fashion than they used to.
All right, Dr. Bhatti, we'll really appreciate the education today. That's Dr. Chandra Bhatti, a transplant surgeon at the VCU Health Hume Lee Transplant Center. Thanks for checking out this episode of Healthy with VCU Health. For more information about the Hume Lee Transplant Center, please visit vcuhealth.org/transplant. If you found this podcast helpful, please share it on your social channels and be sure to check out the entire podcast library for topics of interest to you. Thanks, and we'll see you next time.